Okay, good morning Queensland, and good morning to all of our Facebook live followers, and it's wonderful to be joining you here, and I hope that many people across our great state had time to spend Christmas with their loved ones. Very important time of the year, and we hope that you all enjoyed that very special time. So today we can say that we are not seeing any massive impacts. Sorry, take my sunglasses off. We are not seeing any massive impacts on our hospitals, which is really good news today, but we are monitoring this very closely. I just want to reassure Queenslanders that although we are seeing increase of cases as we have expected, we've been planning for this, we are not seeing the impacts on our hospital system to date. But I want to assure every Queenslander that we are monitoring this very, very carefully. I want to make sure that Queenslanders get their boosters. We know that that booster is an added protection, and I also want to see our children being able to get that first dose before they go back to school. So I'll have more to say about children in a moment. So at the moment, only 4 people are in hospital who are receiving care for COVID-related symptoms, and our Chief Health Officer will talk a little bit more about that in a moment. Yesterday, 24,515 tests were administered by Queensland Health. And of course, we haven't got any increases yet on our vaccination numbers across the nation, because I don't think the Commonwealth provided those statistics yesterday. So with, and we have 784 new cases. So we are expecting those case numbers to increase, but like I said, we are monitoring it very closely. Now, I know there's a lot of elderly people out there across Queensland that are concerned as well. Can I please ask you, when you get the opportunity and you're due to get your booster, to please book in and get that booster shot. We know that's really, really important. Also too, monitor how much you need to go into crowds, but please everyone, wear this mask. This is so important. Going into crowded areas, all of our retail staff must be wearing this, and also when you go into shops, when you go into cafes and restaurants, except when you're eating and drinking, please remember this mask is so important during this particular time. Now, I know there are a lot of parents who are also asking when their children can get vaccinated. So I'm very pleased to say, and of course, people remember that this was an issue I raised up front many months ago, and at the time I was shouted down, but this is really important now, because we know this pandemic can actually have impacts on the unvaccinated, mild symptoms in children, but we do want to make sure that our children are protected. So those children who are under the age of 12, so 5 to 11, from today, Queensland Health will start accepting your bookings for children. So they will be able to start getting their vaccinations from January the 10th. And of course, children will also be able to go to the GPs and the pharmacies as well to get their vaccines. It's important, let's wait that boat goes past, jet skis. It's important that we get as many children vaccinated as we can before school goes back, and children get a smaller dose, of course, and this has been tested, but it is up to you to decide whether or not your children get vaccinated. But the more of our community that are vaccinated, the better, but the Chief Health Officer will talk to you about that a little bit more. And finally, can I just say, look, I do understand that there have been some queues at some of our testing clinics. We had a good discussion about this morning with a range of health officials. We are increasing capacity at Metro North, Metro South, Gold Coast, over the next 24 to 48 hours, and Cairns. So let me just say those again: Metro North, Metro South, Gold Coast and Cairns. So I'll hand over to the Chief Health Officer.
Thank you very much, Premier. So today in Queensland we have 784 new cases, and again the numbers of significantly unwell patients in hospital with COVID-19 remains low, with only 4 reported. We do have one man who is moderately to severely unwell, an 85-year-old man with other medical conditions. So there's one moderately to severely unwell, although not in intensive care and not on a ventilator. I guess it's given the significant number of cases that are active. We have 3,621 cases currently active. The numbers of patients that are in hospital sick suggests strongly that these vaccines are working. It is quite striking. And again, I mentioned yesterday, the patients we're seeing are still on the young side. We haven't seen a lot of patients in the older age groups, but we've seen some. So the vaccines appear to be working. But it is critical that people get their third dose of the vaccine when it's available to them, particularly older people and people who may have some impairment of their immunity. So there's been a total of 5,798 cases since the beginning of the pandemic. There were 24,515 tests performed yesterday. Case locations, again, I won't go through them. They're right across Queensland. You can assume that wherever you live in Queensland, you have the potential now to be exposed to this virus, and you should be living your life as if that is the case, wearing a mask whenever you're indoors or close to other people. Omicron remains dominant in Queensland, about the same sort of proportion at 75%. We're increasing the number of people we're caring for in their homes or in other designated locations. So we have 900 cases who are being managed outside hospital. The number of cases in hospital is down to 68 at the moment, recalling that most of these people are not there because of symptoms related to COVID. And as the Premier mentioned, the vaccination data was not released by the Commonwealth in the last 24 hours. I'll hand back to the Premier. Thank you.
Yep, thanks. Any questions?
You're on the 7th of October, Queensland, reached 50% vaccination. Are you concerned that the other 50% have been vaccinated if we head towards 90%? Are we going to have to wait that much longer before the booster shot, even though they've reduced the waiting time?
Well, I think we're in a better position because people have had that second dose, whereas in Europe, my understanding is there's been a long lag time between that second dose and getting the booster shot. So as long as people book in and get that booster shot, it's great to see that the Commonwealth has opened it up and lengthened the times for that to happen. But until you get your booster shot, the elderly need to be a little bit more cautious. So what I mean is please make sure you have that mask, and if you are going into crowded areas, just think about where you're going until you get that added booster shot. So we're going to be monitoring that very closely, especially between now and the end of January, where it's really important that our children get vaccinated, and it's really important that our elderly get that added booster shot.
It's on the PCR testing requirement.
Yes.
A lot of people now not able to meet 72 hours because of delays in the state for the
Yes.
testing regime. Still no appetite to move that forward on the state government's perspective, the rapid...
Not until the 1st of January, and we're just working out how that can actually get administered. There's a lot of people coming here, but we put that roadmap out and everyone was very clear about that. We are looking very carefully at the day 5 test. We are doing some work about whether or not that could be a rapid antigen test. So we're just having some clarification on that. So we'll be able to update you that in the next 24 to 48 hours.
Just to clear up some confusion, some people
Yep.
think if they've got the test, the 72-hour test, if they haven't got their result, they can't come to Queensland. Are they able to still come to isolate until they receive that result?
We're looking at that. We would prefer them to have their test done before they board. But in some cases that is not possible and they are able to stay in their locations as long as they isolate.
So some people are getting a mixed result at the border, some people are getting ready and others are being turned away.
No, I think they're being pretty consistent,
You
yes.
mentioned that you're enhancing the testing capacity.
Yes.
There's been some frustration expressed this morning with testing centres operating
Yes.
in QNL having a shuttle Ashton Road and Inverloch.
Yeah, so can I, yeah.
Is that encouraging in some ways because they've answered your call to go and get tested, but it's sort of getting ahead of the capacity?
Oh, Queenslanders have done a great job and people are concerned, but if you have symptoms, you should come forward and getting a test. The issue has been some of the private clinics have actually shut down over the Christmas to New Year period. So we expect that over the Christmas to New Year period. That's why our testing clinics are now going to ramp up over this period. But I envisage that once we get through New Year's, everything will pretty well be back to normal.
One testing aspect
Yep.
which hasn't been covered that much is that for elective surgeries you need a 72-hour test to actually enter the hospital, and some people are telling us they're getting surgeries cancelled because they can't meet that deadline. Should they be given some sort of priority in testing so that they can...
I might get the Chief Health Officer to address that, but it's really important now that when people are going to hospitals that they do have a test. I mean, I think people can understand that this is a highly contagious and it's the most vulnerable who are at risk. And especially, you know, people who are in hospital, we want to make sure that they're protected. We want to make sure that the people working in the hospitals are protected as well. So I might get the Chief Health Officer to address that.
Premier, just
Yep.
quickly,
Yes, Josh.
What's the feedback you're getting from the community about vaccinating children?
Yeah, look, this is, can I urge parents, and look, I've got sisters who've got children and they're booking in to get their kids vaccinated. In fact, my little niece says to me, has been asking me during, when we've all been, when the adults have been getting their vaccination, she kept saying, Auntie Stacia, when am I getting my vaccine? So the kids are really well aware of this. Children get vaccinated for a whole range of diseases that we start getting vaccinated from when we're born. So look, I just urge if any parents have any concerns, and it is discretionary, to please go and talk to their GP, talk to a trusted professional, but there has been extensive tests done on this and they're getting a smaller dosage of Pfizer.
When you say it's discretionary, does that mean that the vaccine mandates for hospitality businesses won't apply to children?
They don't apply to children at the moment either, Jack.
And there's no plan to change?
No, there's no plan to change
There
that.
might be a lot of families out there that feel very strongly opposed to this. Have you come across any?
Oh, look, not at the moment, but I do understand that there would be some concerns. I'm asking people to go and speak to a trusted professional about this.
Premier, that 1st of January date that you mentioned, is that
Yes.
set in stone?
For?
The changes with the order
We're looking at that, yes. We're just looking at how it can be administered. So we've got a bit more time to work on it, but we are definitely looking at that 1st of January.
You're having convinced 90% of Queenslanders to get the vaccination.
Yeah.
Replacing the double dosage mark.
Yeah.
Do you think it's going to be a challenge to convince them, given they thought that was going to be full vaccination, but notwithstanding that COVID's obviously a work in progress?
Yeah, look, we've had
Because they couldn't be described as anti-vaxxers if they're hesitant about the booster, could they? 'Cause they've already-
well, I am still very concerned. That's a really good question. I am still really concerned about people who have not been vaccinated at all. We know this is a highly contagious variant. Omicron is very, very contagious. And the evidence shows too that that booster is an added layer of protection. So I think what you'll see is that full vaccine coverage will mean having your first dose, your second dose, and having your booster.
We're seeing mandates for employers in the United States already for a third dose. In UK, I think some employers, or many employers, are insisting upon it. Do you think that could be a tipping point, given people were under the impression they were fully vaccinated with the 2 shots?
Look, this is everything. This is a pandemic. No one knew that there was going to be Omicron. When we put our plans in place, no one knew that there'd be this even more contagious variant out there. Thankfully, the evidence that we are seeing is that it is a milder form, and thankfully we are not seeing the big impacts yet on our hospital system. So we are going to see increases in cases, and I don't want people to be alarmed by that. The real issue here is what is the impact it is having on individuals in hospitals.
Premier, have you been briefed about anyone coming up from New South Wales that thought they were positive from that St Vincent's Hospital?
No, I haven't, Josh, but if there is any information, please let our health authorities know.
With the testing,
Yes, Leah?
from January 1, there's going to be a move from PCR tests to rapid antigen, but it could be brought forward soon after the day.
No, what we're looking is that we might be looking at the day 5 test, making that move to a rapid antigen test in the next 24 to 48 hours. We're just working through some of those issues, but we're looking still at the 1st of January in relation to whether or not we can do the rapid antigen testing instead of the PCR.
Given that, did the government underestimate the pressure that day 5 test would put on the system?
I think no one estimated 400,000 people would apply to come to Queensland. Look, I've spoken to people, I had a good conversation with some people in Melbourne last night. No one is going into the city of Melbourne CBD. There are a lot of people who are coming from Melbourne, who are coming from Sydney, coming into Queensland. Queenslanders want it to be a safe environment, so these are the precautions that we put in place on our roadmap. Everybody knew when they booked a ticket to come here that they would have to adhere by having that PCR test. It was absolutely laid out in concrete. Now that we've had 400,000 border passes, we need to make sure that we are still protecting Queenslanders, but as the world is moving towards rapid antigen tests, it is something that we are closely looking at, and will be guided by the Chief Health Officer.
28,000 people a day, Premier. 28,000
Sorry?
people a day coming in. The tests have been averaging around the 32,000 a day mark. Does that mean there's only 4,000 Queenslanders getting a test? Or
No.
is that level still at about 12,000 where it was before the border opened, and the balance?
Look, it's pretty consistent, but I do want to thank the people who are coming from interstate. They are going and lining up and getting tested. I mean, people are wanting to do the right thing.
Do you know what proportion of...
Oh, no, look, it is encouraging. I am very encouraged, but I don't think anyone expected to see that volume of people coming into Queensland.
Do we know what proportion of our tests are those people doing?
No, I don't, but we do know that the private providers have, some of them have closed down over this period, Jack, and that is making it very difficult for people to get their tests.
And when you say those 4 clinics will be ramped up, what does that look like? Longer hours, more staffing?
Where they're putting more staff in there as we speak.
Sort of public transport network seems to
Yes.
blown a hole in the budget. How concerning is that?
Oh, look, we understand that at this particular point in time, people would be expressing concern about travelling on public transport, but also, too, this is the quietest time of year for people to be using public transport. Workplaces have closed down, people are enjoying time away with their loved ones at holidays. So, look, this is usually the quietest time of year anyway. Okay?
Just quickly, South Australia imposed a few more restrictions. Are you considering anything like that?
Not at the moment. We're monitoring, as I said. I just want to reassure Queenslanders that the Chief Health Officer and I and the government are very closely monitoring the impacts that this virus is having on severity of illness and admissions to hospital. That is something we will closely monitor, and if that changes, I will be addressing you further. You sure can. He's looking forward to them.
Just before you ask questions, can I just say something about testing? Look at the news reports from around the world. Now, with the Omicron outbreak around the world, there are queues for testing on every continent. Look at the United States, Europe, United Kingdom. We're not unique. But on top of that, we have the people coming from interstate visiting Queensland. It was the right decision to open the Queensland borders on the 13th of December. It was the right thing to do to allow families to reunite for Christmas. It has put a strain on the testing capacity, there's no doubt, but it was the right decision. We couldn't have predicted Omicron, no one did. But just look around the world, we are not unique. So
an update on the amount of health workers that have tested positive and how many are quarantined?
yes, I have that number here somewhere. Around, as I've said before, there are tens of thousands of healthcare employees in Queensland Health, so it's not surprising that some become positive. Most of these will get infected with the community. So at present there are around 72 hospital and health service employees who have been confirmed as having COVID, and just over 350 that are in quarantine. We're actually in the process of reviewing our quarantine processes just to get the balance right between who we quarantine, who we need to quarantine, and who maybe it's not so critical that we quarantine.
What specific changes are you looking at?
There's a complex matrix which looks at the nature of exposure, vaccination, or actually they're all vaccinated, the staff, whether the patients, whether the staff are wearing masks. We're moving more towards the New South Wales model, where they have been dealing with larger cases of COVID for a while, and they've been very successful with their model. In the emergency departments, particularly, they're wearing a higher level of PPE. But can I just emphasise, a lot of these people are getting the COVID not from their work. Most are getting it from, like the rest of us, in the community. So we mustn't overemphasise that the problem is in the work environment.
Changing those requirements because there's been so many people in the emergency departments being exposed and having to go into quarantine. Is there a concern about fatigue for the rest of the workforce having to?
Oh yeah, we review our processes every day. Every day, right over Christmas, we've been reviewing them. I've been liaising with my counterpart in New South Wales just to see how they manage the quarantining of staff in hospitals, and also with my colleagues here in Queensland. And they're tweaks. They're not major changes, they're minor tweaks. So the national guidelines are also going to be changing soon, just so that the guidelines were developed for a situation where we're attempting to completely eliminate the virus. Now that we have virus which is quite widespread, all of these processes need to be tweaked, and they're all being tweaked a little bit day by day. We don't want to make everything open slather. We don't just open the borders and open everything and let everything happen. Every day we are discussing both with our colleagues here in Queensland and nationally how these measures can be tweaked gently and pulled back slowly to do it in such a way that we can deal with this pandemic as it arrives.
Gerard, just on the question I was asking before, the Premier, should there be priority given to people who have elective surgery
I'm not specifically. This is a 72-hour test. Certainly patients should not have their surgery cancelled because of a lack of a COVID test. So I would be very interested in the details of that specific case. They should not be having surgery cancelled for that purpose.
Just to clarify, those quarantine requirements, they're only in relation to health people.
Yeah, there are specific measures. There are national guidelines on the specific measures for healthcare workers in the environment where they are seeing COVID patients, or if they see COVID patients, or if they have COVID acquired from the community. And these guidelines are continuously changing, and the national guidelines will be changed soon. We are moving towards more of the New South Wales model. It gets quite technical, and I don't want to get too much into the detail. But there are minor tweaks in who has to stay off work, who doesn't, who gets tested, whether you have to stay off work when you get tested, depending on the nature of your exposure, whether you were wearing a mask at the time, whether that sort of thing.
Dr. Further to the Premier's appeal for people to come forward if they've been double vaccinated to get the booster, and they may have some misgivings about the fact that they've already been double vaccinated. They're not anti-vax, but they think maybe the jury's still out on the effectiveness of the booster shot because of the ifs, buts and maybes. What would you say, just drawing upon your expertise in infectious diseases, to reassure them about what it contains and the protective agent and the risks? What would you say?
Well, two things. First of all, my experience is that people are itching to get the booster. Everyone I speak to really wants to get the booster. But secondly, we can see that when you get that third booster, the antibody levels rise dramatically. Not just a little bit, they rise dramatically, and immunity is greatly enhanced with the third dose.
Side effects, what would you say to them if they're concerned about that?
Well, similar sorts of side effects to what you might have experienced before, like a sore arm. Some people get a fever. If you haven't, the main side effect with the Pfizer and the Moderna vaccine, the main serious side effect was the anaphylaxis, the allergy. If you haven't had anaphylaxis to the previous doses, you won't have it with the third.
Omicron's relatively recent arrival. Do you think the longitudinal scrutiny of its treatment is good enough at this point to reassure people that the third shot's going to work?
We get more information every day. There is increasing data in the real world that the vaccine is effective. Certainly in the laboratory, when you take the blood of people who've had the third dose, it neutralises that virus extremely effectively, and that correlates very well with the real world.
How many doctors and nurses at the Sunshine Coast Hospital now have COVID?
I don't have that specific number, I'm sorry.
The Premier said at the start of the press conference that there'd been no massive impacts on the state and public hospitals given the increase in cases.
No.
Has there been some impact on patient care at emergency level? Did you say?
Not that has been specifically reported to me. Obviously not that it's been specifically reported to me. No.
The PCR testing requirements, we are still having people at the border. They've got the test, they still don't have their results. Some people are being let into Queensland, others aren't. What is the rule?
The police are using a degree of discretion, is the general principle.
So some people are being let in and others are being turned away?
Is this recent information you have? The police are using their discretion, is what is the general principle.
Even when we see those changes from the PCR test to the rapid test, do you have confidence in the reliability of those rapid tests?
The rapid test has a specific purpose. It's a screening test. It's not as sensitive as the PCR, but if we're using it for this specific purpose as a screen from a high incidence state, it's an appropriate. It's still being reviewed by AHPPC, but I support it, and it will be an appropriate test.
What criteria are police using discretion? Because that doesn't seem entirely
It's up to the
fair.
police.
No, I understand.
That's the end. We've had the last.
No, I understand that, but by what criteria are
Go and
police?
ask the police.
Well, the police aren't here, Premier.
No. The police are entitled to use their discretion.
But on what basis?
Well, you'll have to ask the police.
But they're
They
not here.
administer it. That's right. So you'll have to ask the police.
Well,
Okay? I'm not the
But you
police.
seem aware of what's happening.
Because they use their discretion.
But on
Okay?
what basis?
Go and ask them. All right? Thank you.
Gotta go.
Thank you. Thanks, everyone. Thank you for coming out.